Hi friends, myself I am Arthik from Mechanical Department. Today my topic is validate the usage of UV rays in medical field. UV rays. Everyone is exposed to UV radiation from sun and increasing number of people are exposed to artificial source used in industrial, commercial and recreation. The sun is by far the strongest source of ultraviolet radiation in our environment. Solar emission include visible light, heat and ultraviolet radiation. Just as visible light consists of different colors than become apparent in the rainbow, the UV radiation spectrum is divided into three regions called UVA, UVB and UVC. As sunlight passes through the atmosphere, all UVC and most UVB is absorbed by ozone, water vapor, oxygen and carbon dioxide. UVA is not filtered filtered as significant by the atmosphere. Principle of ultraviolet radiation. Ultraviolet radiation is electromagnetic radiation. The frequency of UV radiation lies between that of X-rays and visible light. UV radiation is divided into three bands: UVA, UVB and UVC. Wavelength of 320 to 400, 290 to 320 and less than 290 nm respectively. Application of ultraviolet. The intensity of UV radiation reaches the skin is highest with high power lamp positioned close to the patient with the radiation beam perpendicular to the skin surface. Penetration is deepest for UV radiation with the highest intensity, longest wavelength and lowest frequency. UVA penetrates further and reaches through several millimeters of skin, whereas UVB and UVC penetrate less deeply and almost entirely absorbed in superficially epidermal layers. The penetration of UV radiation is also less deep of skin is thickness or darker. Medical application of UV rays. UV radiation is used primarily in the treatment of serious, and these are also recent reported of UV therapy being used for treatment of other dermatological condition including scleroderma, eczema, cautious T-cell hamphia. These treatments may be applied in conjunction with the uses of potassium drugs. UV is also actually as a component of treatment of chronic open wounds. All through the clinical applications of UV radiation for the treatment of skin disease is with the scope of physical therapy. Such treatments are generally provided by dermatological or these ascents. Prediction and contradiction of UV rays. Photosynthesizing medication and dietary supplies. Photosynthesized medication include sulfonamide, threonine and colonyl antibiotics. Gold-based medications used for treatment of rheumatoid arthritis, amiodarone hydrochloride and quinidines used for treatment of cardiac arrhythmias. Phenolphthalein used for treatment of anxiety and psychosis, and psoralen used for treatment of psoriasis. Contradiction. Introduction of eyes. Expose of the eyes can be avoided by having the petition where UV occupy gears through treatment and by having the therapist where UV aqueous when at risk of radiation such as when trying the UV lamp or off. Skin cancer, pulmonary tuberculosis, cardiac kindly or liver disease, synthesis lamps, arithmetic fever. Adverse effect: burning, premature aging of skin. Thank you.